Bismillahir Rahmanir Rahim. Welcome to our program Vision Talk. Dear viewers, as you know that we bring you this program with the different topics. Actually, the topic nowadays is only Corona, but we give you a different perspective on that topic. And for that purpose, we invite guests from all over the world, from different walks of life, from different professions, who give us a great insight from their own profession, who give us great feedback about the ground realities, who give us great feedback about how they are coping with this crisis on a common person level. Today we have our guest. He is an esteemed doctor, and he's joining us from Houston, Texas. His name is Dr.Qamber. I would like to give a brief introduction about him. He is the board certified gastroenterologist, and he has been in practice for 30 years. He has served as a board member of Texas Society for GI for more than a decade. And this Gastro Society in Texas is the largest medical society in the United States. He is also very active in his community leadership roles in Islamic institutions, and also he is very politically active on the local level. Last but not least, he is the founder of Code Blue Media. It's a local radio group that creates awareness about health issues among local people. And having said that, I would like to welcome Dr. Qamber to our program. Assalamu alaikum, Dr. Saab.
Walaikum salam. How are you all doing there?
Yes, we are doing good. Thank you very much for asking, and we pray to Allah that you and your loved ones are safe and sound wherever you are. So we would like to start the program by asking you my first question. My first question to you is that you are a seasoned physician in Texas. So as a physician, what are the realities? I mean, we're hearing so much from CNN, Fox News, BBC, and the whole global media. But we want to ask you and find out from you that what are the ground realities on the ground in U.S. To address this COVID-19 pandemic.
Thank you. And first of all, let me thank the organization of VNN, Vision News Network, for giving me this opportunity. And I pray for everyone throughout the world, because this is an unprecedented crisis, healthcare crisis. You need to understand, and you've already done a very good job in trying to lay the groundwork in past programs, so people are aware of what a pandemic means. But our salute is to the healthcare workers, whether they be the janitors in the hospitals that are working, whether they are the security guards, whether they're the EMS that are bringing the patients, whether they're home health nurses, the nurses in the ICU, and the doctors. What we are finding is like they are the brave warriors.
They're frontline soldiers. They're the frontline soldiers.
The heroes. Just to give an idea, 1/3 of the healthcare workers in a Brooklyn hospital today are sick.
Oh, wow.
We are seeing reports of doctors and nurses dying because of the care that they are taking care. I mean, we have even seen that in Pakistan, for example. But even here, even young doctors have succumbed to this virus. So this is despite the fact that at this number right now, we have about 1.2 million people who are quote unquote being diagnosed with it. But the fact of the matter is that anywhere from 3 to 10 times people may be infected and they are asymptomatic, meaning that they do not have the symptoms. They may not even have the typical symptoms of cough or fever, and they would be going around in the community. And that's how things are being spread with this virus. So on top of it, we in many states do not have the protective equipment, the PPE. You've probably heard of that a lot. And because of that, the healthcare workers are being affected. But on a positive note, 80% recover. So out of the 1.2 million, already about 330,000 have been diagnosed, but 250,000 have recovered. So there is hope. And the other thing is that, for example, right here in Houston, we have had success in treating patients with what we call as convalescent plasma. So they take out the blood of a person who has been infected, take out their plasma, and then they transfuse on people who are very, very critically ill. So this, since we do not have a since we do not have approved medications, the only thing we can do right now is to have adequate measures of prevention. And prevention in the sense of both personal hygiene and, as your previous physicians who have come to your programs have talked about, social distancing, where you're separating people from each other, because this is a respiratory virus, and when somebody coughs or somebody sneezes, they can spread that around for up to 18 feet or 24 feet, actually. But that 6 feet distance that we are talking about is for that reason. They have also come up with the new CDC guidelines that people who go out in the public should be starting to wear masks, and they can make their own mask at home. It's very simple to do. For us, Muslims, I mean, we are used to niqab, so it's like you just put a little handkerchief on there and put something around your ears, and you should be good.
To support
it. Yeah, so you are actually not trying to prevent yourself from others, but actually you are trying to see that you are not spreading anything to others by your cough or your sneezing. Secondly, on an average, we touch our face about 23 to 24 times an hour. Okay, so they're saying stay away from men. By men, I don't mean men in gender, but your mouth, your ears, and your nose and eyes. So stay, because at any time you are catching things from the doorknobs and stuff, you're going to go and touch your face, and then that's how things are spreading. So it's very, very important to make sure that you are following the public health guidelines that each state and each country has been giving. Secondly, I think from a healthcare perspective, what we are finding is that, unfortunately, this is affecting the poor, this is affecting the disadvantaged, this is affecting more in people who have underlying health problems. So when a country does not take care of their poor, when they do not take care of their sick, as you are well aware, obesity is another pandemic, another epidemic. United States has a very high incidence of it. And obesity actually is also related to poverty. So states that have high incidence of poverty also have a high incidence of obesity, because they don't have the money to go and buy healthy foods, so they go to a McDonald's or Taco Bell and have unhealthy food. They also have a very high incidence of comorbid conditions, meaning previous medical conditions like diabetes, like high blood pressure, like heart disease. and any of those things increases your risk for death or mortality. I can give you one example of Detroit, where Michigan has a population of about 12% blacks, but 40% of the people who are dying there from this are blacks. So there's a disproportionate number of the poor, of the disadvantaged who are dying. And we are also finding by the cellular phone data that even after the governments and the states have asked them to do social distancing, those who are in the higher income brackets are able to do work at home or they're staying home. Whereas people who are poor, who are grocery store workers, who have day jobs or working in the post office, those kinds of small jobs, they cannot, and they're also using public transportation. One of the reasons very high incidence of New York is not only that it is an international hub of people coming from all over the world, but it also has public transportation. So it is definitely affecting more on the poor and the disadvantaged. Same thing going on with the incarcerated population. You're probably aware that 5% of the world's incarcerated are United States. So they are finding that even within the prison systems, we are finding people. So it's a on the positive note, I can say that our technology, our innovativeness in the United States, our scientific knowledge, and the amount of research that is currently being done, trying to find medications to help, trying to find a vaccine to help. But on an immediate short-term basis, we are America first, and as they call themselves, America first, exceptionalism, we call ourselves. We are leading the nation. We are leading the nations in having the highest number of cases in the world. But my hats off to the healthcare workers who are at the front lines, and inshallah, many of them will have a status of a shaheed.
Okay. Thank you very much, Doctor, about this beautiful insight. Like you said, that the ground reality in USA is that those communities who are less fortunate, they are poor or blue-collar class who have to go to work daily and use public transport, they are more at risk. And you gave us an example of Detroit, Michigan, that where it's only 20% black population, but the affected population is. I'm sorry?
In Michigan, the population is 12%.
Yes,
And even throughout the US, it's about 12 to 15%, and majority of the people who are dying are people of color.
people of
And
color,
inner
yes.
cities, whether you're looking at Los Angeles, Chicago, New York, New Orleans, Detroit, majority are inner cities.
Are there?
Where
Mostly they are colored people. They're mostly people who are from a less earning class category. I was personally in Michigan for about 5 years, and I was in the north part of Michigan, Upper Peninsula, and the population of other communities like non-white communities was very, very less. My next question to you is that not only you are a doctor, you are a medical journalist also. So as a medical journalist and a radio host, because you founded Code Blue Media, how can the media help during this crisis? Like, what role can the media play during this crisis?
I think the number one role for us, whether it is Code Blue Radio, whether it is Vision News Network that you all have formed, is to give the right information based, particularly from a healthcare perspective, particularly based on science, based on facts. So let me do some myth busters, if you want, on this COVID-19. Okay, drinking garlic might give you social distance from your family and your spouse, but it's not going to cure. I mean, it has antibacterial properties,
But this
and
is a viral infection, right?
but this is a viral infection.
Yes.
Uh, so, taking a deep breath, get up in the morning, take a deep breath, 10 seconds, and if you can hold your breath, that means you don't have COVID-19. No, sir. That has not been shown in anything. Going in a steam shower, that has not been shown to have anything. What else is coming up in whatever APA? I call it whatever APA. WhatsApp is like a whatever APA. One APA sends it to another APA, one bhai sends to another bhai, and it keeps on going. And then you would see the same message coming 3 to 4 years later. So I think, um, you know, hot climates. There's a thing that suddenly, when summer comes, there's 30 degrees. This is going to go away. It has not been shown, nor does snow protect you. I mean, we are finding cases in countries where there's snow, and we are finding it in countries that are hot. This virus does not. I mean, there's a potential, and based on our experience in 1918 with the Spanish flu, that by the fall and the summer it might go, but there's no research to say that this is related to a climate or environment. Same thing is related to different types of medications. There's a lot of thing about hydroxychloroquine, Plaquenil, as well as azithromycin or Z-Pak. They are very, very limited studies. These are not double-blind studies. They have side effects. So you cannot say that you will be able to take this and prevent. And try to understand that there are patients who need these medications for other conditions. People are hoarding medications. So there is no medications available at this time. There is no vaccine available at this time. Uh, the hope is that this convalescent plasma is going to work. Their hope is that the antiviral medications that have worked for SARS and HIV and those kinds of illnesses, it might work, but this is still a very, very preliminary data. So I think the best thing that media can do is to give knowledge. So, as I was saying, it's important, I think, for the media to make sure that the viewers and the listeners are able to get the right information from the right people who have the knowledge base, particularly in a situation where we are facing with a novel virus. Even the most uh, research oriented scientific people are still understanding the impact of this virus. So we can base it on the knowledge we already have from previous pandemics, and based on that and based on how they responded and were successful, they are making those recommendations. So when the public health people tell us to do social distancing, that is related to some scientific basis. But on an economic front, it is very, very difficult, particularly for cities as well as countries that have a high density population, as well as a high incidence of poverty, to tell people to stay at home. So if you have a very densely populated city like, say, Karachi or Mumbai or Tokyo and stuff like that, it is going to be very hard for them to say, don't go to work. And you saw what happened at the national shutdown that was done with 4 hours notice in India, and how people just walked out because they don't have any food. So one potential implication
Okay.
of this is going to be the increase of hunger in the world.
Okay. Dr. Qamber, I'm sorry to interrupt you. Like you said, that we should be listening to medical professionals. We do call medical professionals on our program, and some of them have recommended like certain diets. This is a very quick question. Like, for example, to boost our immunity, we should, lean towards more healthy foods like citrus and fruits to get more
Yes,
intake of
definitely.
vitamin C. That's helpful, right?
So you
Okay,
need
great.
good sleep, you need good nutrition, and more importantly, you also
Okay,
need
very
good
nice.
mental health. And Alhamdulillah, as Muslims, as believers, there is the saying of, I think, Imam Naqi alayhi salam, which says a believer has two wings, a wing of hope and a wing of fear. So we need to balance that out. And this is the best time for anybody to get connected with Allah subhanahu wa ta'ala and our Aimma. It is the best time for us to spend time with our family. And the holy months of Rajab and Shaban and Ramadan is full of barakat. So instead of just focusing ourselves 24/7 on COVID-19, it might be good for us to reflect
We should
ourselves.
be.
Uh,
We should. Yeah, we should reflect upon ourselves. Dr. Qamber, thank you very much for this great insight. My last question to you, I was going to ask you, but you have basically answered that already. My last question was that what are the economic implications of this pandemic, both locally and in US and globally? But I believe you have answered most of it already, that how it's affecting the different economic classes and people who are poor and people who do not have access to healthy food. I want to thank you on behalf of our whole team that you took this time and you gave this time to us and you shared this wonderful feedback and your insight and your professional opinion for our audience. So we want to thank you for that. So dear viewers, as you know that we are continuing and we are evolving our program Vision Talk. We are bringing our esteemed guests from all over the globe, people who are like doctors, lawyers, political activists, religious activists, even general taxi drivers. So from a common person to a health professional, we are trying to bring everyone into this program so that you can benefit from their knowledge, and we hope and pray that you are. We, as always, we hope and we pray to Allah that you and your loved ones are safe and healthy, and we hope that you are benefiting from our program. We will see you inshallah in our next program. Until then, Allah Hafiz.